All right. Good morning and welcome to your last Friday. Last Friday in your RLE NCM 112. All right. So we're going to talk about the arterial blood gas. Okay. So this is all about the extraction of blood. Okay, so the procedure and how are you going to extract blood. But of course, this is not our responsibility, but still it is nice for us nurses to know, okay, how to prepare patient. Okay, so that you will have the idea, you have the knowledge, and how to inform or educate our patients whenever there will be an ordered for ABG analysis. Okay, so A, B, G, E, F, G, sala. Okay. All right. So advance Merry Christmas. Okay, so what is ABG? Of course, so this is arterial blood gas. Okay, this is a blood test that is performed using blood from an artery. Okay, so based on your anatomy and physiology, so you know already where are the arteries and what does artery carries type of blood. Okay, of course, it is oxygenated blood away from the heart. Okay, so that will be delivered all over the body. Okay, so of course it will involve puncturing an artery with a thin needle and of course a syringe, and then drawing a small volume of blood. Okay, so the most common puncture sites are the radial artery. Okay, sa ating wrist. Okay, which is usually that's what I am seeing or observe. And of course, sometimes the femoral artery in the groin or other sites are being used. Okay, so this is a picture, okay, of where we can extract blood for ABG analysis. Okay, so it measures oxygen and carbon dioxide levels in blood. Okay, so of course we have to know or we have to measure the body's acid-base balance, which is the pH, and in normal persons or healthy persons, of course, that should be balanced. And we all know what's the normal level of our pH. Okay, so we have 7.35 to 7.45, or in the absolute value falls at 7.40. Okay, so we say 7.35 acidic, and then of course to your right going to 7.45, that will be alkalotic. Okay, so of course what are the objectives? So we have to understand the terminologies in ABG. Okay, of course what are the indication, okay, and contraindications in performing the arterial puncture. Okay, and we have to, of course, you have to know how to demonstrate, well, not really demonstrating, because you will not have your return demonstration for this. But at least you know how to the techniques in performing the arterial puncture. Okay, so these are the common terms that we should know. Okay, so PaCO2, which is all about the ventilation. Okay, so this is the partial pressure of arterial carbon dioxide. Okay, so the amount of oxygen, okay, carbon dioxide rather, in the artery. Okay, PaO2, so this talks about, or this is all about the oxygenation, which is the partial pressure of arterial oxygen. Then we have HCO3, that tells us about metabolism, okay, bicarbonate. Okay, so of course when we talk about HCO3, so we are trying to deal here with the kidneys function. Okay, SaO2, or the oxygen saturation, and of course pH, acid base balance, and Be, capital B and E, base excess. All right, so these are the components of the arterial blood gas. So amount of carbon dioxide dissolved in arterial blood. Okay, our normal range is uh, 35 to 45 millimeters mercury. Then we have PaO2, which is the partial pressure of oxygen that is dissolved in arterial blood. Okay, our normal range is 80 to 100 millimeters mercury. Then we have the bicarb, okay, calculated value of amount of bicarbonate in the bloodstream. So the normal range is 22 to 26 milliequivalent liters. So if you can still remember what milliequivalent is, so it's the amount of substance being dissolved, okay, in the with hydrogen ions or something like that. Okay, so milliequivalents. That will be milli, so 1,000. Okay, yeah. So then we have the SaO2, the arterial oxygen saturation, which is normal at 95% to 100%. Then we have the pH, so acidity or alkalinity. That's what we are talking about here. So based on the hydrogen ions present. So the normal range again is 7.35 to 7.45. So BE or base excess, so that indicate the amount of excess or insufficient level of bicarbonate in the system. Okay, so our normal range is -2 to +2 milliequivalent per liter. Okay, so of course that will indicate, so if the base excess is negative, so that will indicate base deficit in the blood. Okay, so these are the normal values in a table. Okay, so ABG analysis is indicated, okay, so that we can assess the ventilatory status, okay, oxygenation and acid-base status of our clients. Okay, so to assess the response to an intervention, okay, regulate electrolyte therapy, and of course, preoperative baseline parameters so that we can determine laboratory results, status of the patient before undergoing any surgery or any procedure. Okay, so because if our because these arterial blood gas test result may show whether our lungs is getting enough oxygen, okay, or our lungs is, getting rid or removing enough carbon dioxide, or is our kidneys or are our kidneys working properly? Okay, so that will so I think you have finished your ABG analysis in your lecture. So this is just the procedure of how to take the extract blood. Okay. So the equipment that you are going to prepare. Okay. So arterial blood gas syringe. Okay. This is usually done by doctors and of course by medical technologies. Okay. Uh, Needles, so ang ating gauge ay 20, 23, and 25 of different lengths. So alcohol wipe, of course, with 70% isopropyl, gauze, tape, lidocaine. Okay, of course, this is for local anesthesia. Sharps container. Okay, so wherein you're going to dispose the needles. Gloves, apron. Okay, yeah. Okay, so this is a picture of what you're going to prepare. And usually, the equipment is already packed in a certain, available, okay, as a package na. So why order an ABG? Okay, of course, that will aid in establishing a diagnosis. Okay, it will help guide treatment plan. Okay, aids in ventilator management, improvement in acid-base management allows for optimal function of medication. And of course, the status, okay, of our electrolyte levels. Okay, and that will be critical to our patient care and the status of the patient. Okay, so we prepare, of course, the arm of the patient. Okay, so we place preferably on a pillow for comfort with the wrist extended. Okay, 20 to 30 degrees. Okay, so we have to prepare all the equipment. Okay, using an aseptic non-touch technique. Okay, palpate the radial artery on the patient's non-dominant hand. Most pulsatile over the lateral anterior aspect of the wrist. Okay, so dito tayo. Yan. So, alam naman ninyo ang inyong radial. Okay? So, you can feel the pulsation there. Okay? And then cleanse the site with an alcohol wipe for 30 seconds and allow to dry before proceeding. And then wash hands again. Then we have to don gloves and apron. Prepare and administer lidocaine subcutaneously over the plant puncture site. Okay? So aspirate so that we can ensure that we did not hit any blood vessel. Okay. Then allow at least 60 seconds for the local anesthetic to work or take effect. Okay, and of course, attach the needle to the ABG syringe, expel the heparin. Okay, so you know already what is heparin, and pull the syringe plunger to the required fill level. Okay, and of course, we have to check, okay, the local laboratory about the amount of blood, okay, to be extracted. Okay, so in taking the sample, so palpate the radial artery with your non-dominant hands, index finger around 1 centimeter proximal to the planned fracture site. Okay, so warn the patient you are going to insert the needle, okay, so that the patient will not be surprised. And then we hold the ABG syringe like a dart, okay, inside the ABG needle through the skin at an angle of 45 degrees. Okay, so over the point of maximal radial artery pulsation. So we have to advance the needle into the radial artery until you observe blood flashback into the ABG syringe. Okay? So medyo mabilis yun kasi pulsating yung blood. Okay? So the syringe should then begin to self-fill in a pulsatile manner. Okay? So once the required amount of blood has been collected, remove the needle and apply immediate firm pressure over the puncture site with some gauze. Now, sometimes the mostly, okay, most of the time they use the syringe which automatically locked. Okay, the automatically the syringe will lock after the required amount of blood has been extracted. So then we engage a needle safety guard. Okay, so well, normally we do not recap. Okay, and then remove the ABG needle from the syringe and discard safely into the sharps bin. Okay, place a cup on the ABG syringe and label the sample. So it is important for proper identification. So yourself or a colleague should continue to apply firm pressure for 3 to 5 minutes, okay, to reduce the risk of hematoma formation. And of course, to stop the bleeding. Okay, and to complete the procedure, okay, you have to dress the puncture site, thank the patient, of course, for cooperation, dispose gloves and equipment into an appropriate clinical waste bin, wash hands, and then you have to take the ABG sample to the laboratory, okay, as soon as possible. No longer than 10 minutes, okay, so that we can have the accuracy of results, okay? That's it. And of course, ABG blood gas analysis. So I think you have finished this in your lecture NCM 112. So of course, you know already when you have to consider this acidosis and then alkalosis. Okay, so when the PCO2 is high, so it's acid, okay, or acidic. When the bicarb is low, okay, so that will be acidosis, and we put there metabolic. Okay, alkalosis, so low PCO2, and of course high bicarbonate. And then you have to determine if it's partially compensated or fully compensated or not compensated at all. So I think you are very good on determining that. Okay, so it was already taught to you, okay, how to determine the analysis, okay, of ABG. All right. So what are the complication, okay, related to ABG extraction or sampling? Okay, so arterial spasm, yes, hematoma, okay, nerve damage. You can even damage the nerve, fainting, and other problems that can include a drop in blood pressure, complaints of feeling up to pain, and of course sweating or pallor that may precede a loss of consciousness. Okay, that's it. Finish with your ABG analysis or extraction of blood. Okay? So just a reminder, never stop learning because life never stops teaching. Thank you so much and hope you enjoy your Christmas vacation. Okay, have a very healthy Merry Christmas and advance happy, healthy New Year. Gosh, smile ever. Thank you so much.